Imagine feeling like you're trying to breathe through a straw. That's what having an asthma attack can feel like. Asthma, a chronic disease that inflames and narrows the airways in the lungs, is a reality for millions of people around the world. It's an invisible battle that many fight daily, and its prevalence is growing. Asthma doesn't discriminate, affecting people of all ages, genders, and races. It's a global health issue, impacting millions of lives every single day. Whether it's children missing school, adults having to take time off work, or the elderly facing increased health risks, the ripple effect of this condition is far-reaching. Despite this, awareness and understanding of asthma remain limited. Many people underestimate its severity and the impact it can have on individuals' lives. But as we delve deeper into this topic, you'll discover that asthma is not just a minor issue. It's a widespread problem that needs our attention. Asthma isn't picky, it can affect anyone at any age. But what causes it? Well, the exact cause of asthma isn't known, but it's believed to be a combination of genetic and environmental factors. Some people are born with a predisposition to the condition, and certain triggers in their environment can set off an attack. For instance, exposure to allergens like dust mites, pet dander, mold spores, or pollen can provoke asthma symptoms in some people. Even non-allergic triggers like cold air, exercise, or smoke can cause an asthma flare-up. Infections, particularly respiratory ones, can also be a trigger. Additionally, there's evidence to suggest that asthma can be hereditary. If your parents or siblings have asthma, you're more likely to develop it too. Now let's talk about symptoms. Asthma is notorious for its ability to mimic other conditions, which can sometimes make it tricky to diagnose. However, there are some common signs that can point towards asthma. The most recognizable symptom is probably shortness of breath. This happens because during an asthma attack, the airways narrow and produce extra mucus, making it hard to breathe. Another common symptom is wheezing, a whistling or squeaky sound when you breathe. You might also experience chest tightness or pain, particularly during an asthma attack. Then there's coughing. Some people with asthma have a persistent cough, while others might only cough during an attack or at night. This coughing can be dry or might produce mucus. It's also important to note that asthma symptoms can vary from person to person. Some might have infrequent asthma attacks, while others might have symptoms all the time. And for some, asthma is a minor nuisance, while for others it can be a major problem that interferes with daily activities and may lead to life-threatening asthma attacks. So, while it's a complex condition with many variables, understanding these causes and symptoms is the first step in managing asthma. What's it like living with asthma? Let's delve into that. Asthma, a chronic lung condition, can create a significant hurdle in one's daily life. It's like trying to breathe through a straw, all day, every day. Imagine preparing for a morning jog, but even before you step out, your lungs start to protest. They tighten, making it hard to breathe. Now imagine this happening when you're climbing stairs, playing with your kids, or even laughing at a joke. The unpredictability of an asthma attack can make simple tasks seem daunting. Work life can be equally challenging. Picture needing to explain to your boss yet again why you're late because an asthma attack hit you on your commute, or trying to focus on a meeting while your chest feels like it's being squeezed. Quality of life? That too can take a hit. Nights out with friends, family gatherings, or even a trip to the movies may require meticulous planning and could still end in an emergency room visit. Yet amidst these challenges, there are stories of resilience. Take for instance a professional dancer we know. Despite her severe asthma, she's managed to keep dancing and even run a successful dance studio. Or consider the countless athletes competing at the highest levels, not letting their asthma hold them back. Asthma might pose challenges, but it doesn't have to define your life. So, you suspect you have asthma. What now? Well, the journey typically begins with a visit to a healthcare professional. They will start by asking about your symptoms and medical history. If asthma is suspected, they may conduct a physical examination, focusing on your chest and respiratory system. Next comes the crucial part, lung function tests. These tests measure how much air you can breathe in and out, and how fast you can exhale. The most common one is spirometry, which involves blowing into a tube attached to a machine called a spirometer. It's simple, painless, and can provide valuable information about your lung health. Sometimes a bronchodilator, a medication that opens up the airways, is used during these tests. If your lung function improves significantly after using it, that's a strong indicator of asthma. But diagnosis doesn't end there. Your doctor may also recommend additional tests to rule out other conditions that can mimic asthma, such as heart disease or chronic obstructive pulmonary disease. These may include chest X-rays, allergy tests, or even a trial of asthma medications to see if they help. Once the diagnosis is confirmed, it's time to discuss treatment. The goal of asthma treatment is twofold: to prevent chronic and troublesome symptoms, and to maintain normal lung function and normal activity levels. Treatment typically involves a combination of medications and lifestyle changes. Medications can be divided into two categories: long-term control medications, which are taken daily to keep asthma under control, and quick relief or rescue medications, which are used to treat asthma attacks. Long-term control medications include inhaled corticosteroids, which reduce inflammation in the airways, and long-acting beta agonists, which relax the muscles around the airways. Quick relief medications, on the other hand, include short-acting beta agonists, which provide immediate relief during an asthma attack. In addition to medications, lifestyle modifications can play a crucial role in managing asthma. These include avoiding triggers, such as allergens and irritants, maintaining a healthy weight, and exercising regularly. Alternative therapies, such as breathing exercises and herbal remedies, are also gaining popularity. However, it's important to remember that while these can complement conventional treatment, they should not replace it. Always consult your healthcare professional before trying any new therapy. Finally, remember that everyone's asthma is different, and what works for one person may not work for another. That's why it's crucial to work closely with your healthcare professional to find a treatment plan that works for you. Remember, managing asthma is possible with the right treatment plan. Living with asthma doesn't mean living in fear. There are ways to manage it. Asthma is a condition that can be controlled with the right strategies and lifestyle modifications. Let's explore some practical tips to help you manage asthma effectively. Firstly, it's crucial to be aware of your triggers. These are factors that can cause an asthma flare-up. Common triggers include allergens like pollen, dust mites, and pet dander, irritants like smoke and pollution, and respiratory infections. By identifying and avoiding your triggers, you can significantly reduce the likelihood of an asthma attack. Next, maintaining a healthy diet is essential. Certain foods, such as those rich in omega-3 fatty acids like fish and nuts, are known to reduce inflammation in the lungs and can help manage asthma symptoms. It's also advisable to stay hydrated and avoid foods that can trigger allergies, such as shellfish, peanuts, and soy. Regular exercise can also play a significant role in asthma management. While some may worry that physical activity could trigger an asthma attack, with the right precautions, exercise can actually improve lung function and overall health. Activities like swimming, yoga, and walking are particularly beneficial, as they are less likely to trigger asthma symptoms. Another important aspect of managing asthma is medication adherence. Always take your medication as prescribed by your healthcare provider. This includes daily controller medications that reduce inflammation in your lungs and rescue medications that you use during an asthma attack. And let's not forget stress management. High stress levels can trigger asthma symptoms, so it's important to find ways to relax and decompress. This could be through yoga, meditation, or even reading a good book. Finally, regular checkups with your healthcare provider are crucial. These visits allow your provider to assess your asthma control and make any necessary adjustments to your treatment plan. Taking control of your asthma starts with making healthy choices. By understanding your triggers, maintaining a healthy diet and exercise routine, adhering to your medication, managing stress, and keeping up with your doctor's appointments, you can live a healthy, active life, even with asthma. When it comes to managing asthma, some products can make a world of difference. One of the most essential tools is an inhaler, a portable device that can swiftly deliver medication to your lungs during an asthma attack. There's also the peak flow meter, a simple device that measures how well your lungs are working, helping you track your asthma over time. Air purifiers can be a game changer too. These devices filter out common allergens and pollutants from the air in your home, reducing asthma triggers. And let's not forget allergen-proof bed covers. These can help to minimize exposure to dust mites, a common trigger for many asthma sufferers. Now, it's important to clarify that while we may receive support from some of the brands we mention, our recommendations are always based on the potential benefits for you. These products are tools, not cures, but they can make managing asthma easier. Asthma is complex, but we're not alone in trying to understand it. Asthma, like many health conditions, is a puzzle. To solve this puzzle, we turn to experts who dedicate their lives to studying it, as well as individuals who live with it every day. Let's first hear from Dr. Parker, a renowned pulmonologist who has spent over 20 years in the field. Asthma, she describes, is like a storm in the lungs. It can be calm one moment, And then with little warning, it can wreak havoc. It's not just about managing symptoms, it's about understanding triggers and working toward prevention. Next, we have Jason, a marathon runner and an asthma patient since childhood. Asthma doesn't define me, he states. It's a part of my life, yes, but I've learned to adapt. I've worked closely with my doctor to create an action plan, and I stick to it. I'm not just surviving with asthma, I'm thriving. Our third perspective comes from Sarah, a pediatric nurse and mother of an asthmatic child. It's scary when your child can't breathe, she shares, but we've learned to manage. We keep our home as dust and allergen-free as possible. We also have regular checkups, and our doctor has been incredibly supportive. Lastly, we hear from Dr. Gupta, a leading researcher in asthma treatments. It's an exciting time in asthma research, he expresses. We're discovering new treatments, understanding the genetic components, and finding ways to predict and prevent asthma attacks. The future is hopeful. Each story, each perspective, adds another piece to the asthma puzzle. It's a multifaceted condition, influenced by environmental factors, genetics, and lifestyle. But with the right knowledge, support, and management strategies, it doesn't have to limit anyone's life. Asthma might be complicated, but with expert insights, we can navigate it together. Remember, it's not about fighting asthma alone, it's about building a team that includes medical professionals, supportive loved ones, and, of course, you at the center. With the right team, understanding and managing asthma becomes a shared journey. Together we can weather any storm asthma may bring. Asthma raises a lot of questions. Let's answer some of the common ones. Is asthma a lifelong condition? Typically, yes. Asthma is a chronic condition that often starts in childhood. However, symptoms can change over time, sometimes disappearing altogether. But it's vital to remember that even if symptoms are not present, asthma is still there. Can asthma be cured? Currently, no cure exists, but it can be effectively managed with the right treatment plan. Some people may even experience long periods without symptoms. Is asthma contagious? Absolutely not. Asthma is an inflammatory disease of the lungs, not an infectious condition. It cannot be passed from person to person like a cold or flu. Can exercise trigger an asthma attack? Yes, it can. This is known as exercise-induced bronchoconstriction. However, with proper management, many people with asthma can exercise without issues. Regular physical activity is actually beneficial for overall lung health. Is asthma only triggered by allergies? Allergies can certainly trigger asthma symptoms, but they're not the only culprits. Other triggers can include cold air, exercise, smoke, and even strong emotions. Can I use an inhaler too much? Over-reliance on a reliever inhaler can be a sign that your asthma is not well controlled. It's important to follow your doctor's advice on medication use. Can you grow out of asthma? Asthma symptoms can change over time, and some people may experience fewer symptoms as they age. However, it's still important to monitor and manage the condition. Armed with the right information, we can dispel myths and fears about asthma. You're not alone in this fight against asthma. There are numerous support groups and online communities out there offering a wealth of information and shared experiences. Places like the Asthma and Allergy Foundation of America and the American Lung Association provide great resources and platforms to connect with others. There are also numerous apps and websites that can help manage symptoms and triggers. Remember, sharing your journey can be a powerful tool in managing your asthma. Together we can breathe easier. We've learned a lot about asthma today, but this is just the beginning. We've unraveled what asthma is, the causes and the symptoms associated with it. We've delved into its impact on daily life, sharing personal stories to make the journey relatable. We've explored how asthma is diagnosed and the various treatment options available, both conventional and alternative. We've offered practical tips for managing the condition and introduced evidence-based products that can supplement its management. But remember, this is just a guide. Every individual's experience with asthma is unique. It's crucial to seek professional advice for personalized guidance. Before trying new products or treatments, always consult healthcare professionals. They can provide you with the best advice tailored to your specific condition and needs. Remember, knowledge is power. The more you know about asthma, the better equipped you are to manage it.